screen here. That's why, yes. So here is the title of the webinar, and it's really a great honor for me to moderate this webinar today. Before we go to the topic, I will just start with very simple technical issues because I think they need to be covered so everyone can be with us from the beginning. So the most important thing is that this webinar is translated into English and Spanish. So it's just for you to choose the channel by clicking on the globe in the Zoom, and you will hear it in the language that you prefer. What is also very important is that this webinar will take 1.5 hours, and we believe that this is enough space that we also can have conversation. So you can already start sending questions, or when we start the topic, you can send questions through questions and answers, where we will be able to see them and either reply directly there, or we will pick the questions and take them into the conversation with all the speakers that are here. Or you can also write your comments in the chat. So you are really welcome to contribute. What is good for you to know, that is a very usual question, is whether the presentations will be shared. So the presentations will be sent out and they can be shared, and this webinar is also recorded. First, what will happen is that all speakers will get their space to present the topics, and then we will have time for questions and answers. And in the end then of the webinar, we will have closing remarks. So this is the structure of today's webinar. And now I would like to really express how honored I am that I can moderate this conversation today. My name is Kristina Šperková. I am president of Movement International, and I am really honored to be part of this group of people that you can see now also on the screen of the speakers and organizers of this webinar. The webinar is organized by PAHO and WHO Europe. As you can see, we will have speakers from both regions here, as well Deborah Kestel from the WHO in Geneva, the global, and then we will have researchers and civil society representatives who will talk closer or like more detailed on the issue. And just very personally, also from my perspective, let me just stop sharing. What I wanted to tell you is that this year is actually 10 years since I started engaging in the issues of alcohol and women's rights. And when I realized the impact of alcohol on women, I thought like, but this is huge, like this, everyone should know that. And I, of course, also believed that as soon as people will know, then they will also act. So I imagine that if the women's rights movement understands the tremendous harm that the products and practices of the alcohol industry are causing, that I will see crowds of women boycotting the companies, and that there will be incredible support for alcohol policy, because we have measures that we know that work and that can reduce this harm. And we know also what the barriers for the implementation of this of the measures is. So I thought we will solve it. 10 years later, I'm still waiting for the crowds to join, but I actually really hope that something is moving. I'm really incredibly thankful for this webinar, and I hope that this webinar will also move a little bit the understanding of the harm and motivate more people, especially everyone who really cares for women's rights and the situation of women, to also for the support of alcohol policies that are the solution. And I believe we will hear much more about it. So this was 10 years ago. 2 years ago, the pandemic started, and we have, of course, asked ourselves back then, and then for several months into the pandemic, we were asking, so what are the consequences of this pandemic on alcohol use? Will it increase? Will it decrease? Will people have even more problems with alcohol? And we will get to hear about that during this webinar, and really especially the impact of the pandemic on women and their situation. So I'm really looking forward to that, and I would suggest that we actually move to the content, and I would like to then introduce the first speaker with opening remarks. That is Deborah Kestel from WHO in Geneva, who is the director of the Department of Mental Health in the World Health Organization. So please, Deborah, the floor is yours.
Thank you, Christina, and thank you to my colleagues Maristela and Karina for this opportunity to join this panel on such an important issue. The name of the department is Mental Health and Substance Use, and I'm saying this because yes, substance use, including alcohol and other addictions, is part of the mandate and the responsibility that we have. During the first few months of the pandemic, when we initiated to put out messages for the different stakeholders, but also for the general population, we focus on specific population groups that we knew would require special attention when talking about mental health in a broader perspective, and there were a number of different reasons. Among those were groups, first responders and frontline workers, children and adolescents, older adults, but also we talk specifically about women. And the concerns regarding women were, on one hand, about their role in many, if not most, societies, assuming that a larger portion of their households management was already falling on their shoulders, and that will continue during the pandemic and will be increased during the pandemic in terms of ongoing health issues and concerns, schooling at home, managing the economic challenges, etc. But on the other hand, also the risk of increased consumption of alcohol and drugs, and then also potentially increased domestic violence and abuse. These were also areas of concern. Now, recently, a few weeks ago, we published a scientific brief on the mental health impact of COVID-19. And that brief confirms that, in fact, women have been more affected by the pandemic than men. And this difference is in part related to the disadvantaged financial situation compared to men. We know that, again, in most countries, lower salaries, fewer savings, less secure environment, employment conditions. Women have taken also a bigger impact or have absorbed more of the stress in their homes, always related on one hand to the provision of care, healthcare, informal care within the household, but also issues that grow and in many cases were very significant in terms of school closures. Unfortunately, also the violence against women and girls was intensified in the first year of the pandemic, with 45% of women reporting to have experienced some form of violence against women, either directly or indirectly. And we know that this is often linked to alcohol and drug use. So even if our knowledge from a global perspective about what kind of impact COVID has had so far on harmful use of alcohol is still limited at this global level, there are trends that are showing increase in some areas, decrease in others, and we are paying careful attention to those trends and to learn as much as possible to come up with measures and policies that are going to be useful to countries. But I'm sure that we will learn much more of this during the specific webinar today. So just to conclude, I would like to highlight that attention to mental health, again, in a broader sense, has significantly increased globally during the pandemic in many contexts and different countries. I would say probably all. Now, this attention is extended in many of these contexts to alcohol and substance use-related issues. So we need to use this opportunity to advocate for better attention, for better policies, better care for all those affected by these issues, in this case, particularly for women. From our side, you may know there is a global action plan for alcohol 2022-2030 that has already been endorsed by our executive board in January, and is going to be discussed during the World Health Assembly in next May. So we hope that this will give us also a good framework to move this agenda forward. And with this, I'm passing back the floor to you, Christina, and the colleagues for the discussions. Thank you.
Thank you very much for presenting this situation and what kind of impact of it had on the mental health of women from the beginning, which is also very interesting now. Of course, like with hindsight, we are also even smarter than we were in the beginning. But what was the sad situation in the start was that alcohol was very often presented as an essential product and was allowed, and we could see also that there was a huge concern for women's situation at home at one hand, and on the other hand, still alcohol was made an essential product. So it's a very contradictory behavior. But now we know that hopefully that was also a lesson. And what we also know is that the WHO Europe has reacted very fast in the beginning of the pandemic, already giving the recommendations of how to treat alcohol. So now I would like to give the floor to Karina Ferreira Borges, that is an acting director of WHO European Office for the Prevention and Control of Non-Communicable Diseases. So please, Karina, the floor is yours.
Thank you, Christina, and good morning, good afternoon, good evening to all the participants here. Thank you for giving me the opportunity. It is really a true pleasure to be here and to be surrounded by all the colleagues and all the people with whom we've been engaging in the past years. And Christina, as you were saying in the beginning, I mean, this has been a long walk, and it will continue, like in other areas where we know that we need to progress. Like I mean, tobacco was one of those areas that we had to have a long walk until we managed to have results. So I really thought it was very nice when you started by saying, you know, I thought that I would bring all the women and that everybody would come with me. But then when I looked around, I mean, they were not there. So this means that we still have a lot to do. And we hope that with this initiative and many others, I mean, we'll be able to support and provide more information. And I mean, the fantastic work that we have been doing together with PAHO in really bringing to the attention many of these key areas. Like, I mean, we did quite a lot of work on the cancer, and also bringing this to the light of the discussion, especially with women. So we hope that we will continue to in this path of great collaboration. So we also have, I can see, I mean, almost 200 people now connected with us, which clearly shows how important this topic is and how important it is also to reflect on women's experience in relating to COVID-19 pandemic and alcohol use. So before I go and give the floor to all the great lineup speakers that we have here today, I would like to remind everyone that we are organizing this webinar in celebration of the International Women's Day. This was on the 8th of March, as well as the Women's History Month, which is also celebrated in some countries. So it seems that it's appropriate to briefly remind ourselves a little bit about the history of International Women's Day to fully highlight the importance of women today. So let me start by saying that although there's some debate in the matter, the origins of this day goes back to the beginning of the 20th century. And they are closely linked to the history of labor movement and also the history of women's fight for equal rights, equal pay, and also the equal participation in the society. I keep telling my daughters, we have many examples of how important it was to gain these equal rights. And we have also examples of how in countries where these equal rights, or at least, more rights for women have been achieved, in these countries, there are histories already of going backwards. So we should not take this for granted. And it is really important that we keep up on this movement, because we still need to progress and we still need to continue on this path. So the first Women's Day was not a holiday where women would receive, flowers, gifts, and postcards. I mean, there's still this celebration, but it was about a large, workers' demonstration in New York in 1908, where more than 15,000 women have marched the streets and demanded the right for voting and for better working conditions. I'm from the time where my mother could not wear jeans because it was not supposed for a woman to wear trousers. So I keep it in my mind, how much we have progressed, but at the same time, how we still need to progress. So in 1910, it was here in Copenhagen, where I am now, where German delegates of the International Socialist Women's Conference have proposed to have an annual Women's Day, a suggestion that was approved unanimously and that has sparked a movement, rallying thousands and millions of workers and activists for the decades to come. In 1975, the United Nations held the first UN World Conference on Women in the Mexico City, where the Declaration of Mexico on the equality of women and their contribution to development and to peace was adopted, as well as the 8th of March as the now known International Days of Women. This has also marked the beginning of the United Nations Decade for Women, the goal of which was the promotion of equal rights and opportunities for women around the world. This year's UN theme for the International Women's Day is about gender equality today for a sustainable tomorrow. And with this, the UN recognizes the contribution of women and girls who are leading the way to build a sustainable future for all. So coming back to today's topic of the discussion, I wanted to emphasize that a sustainable tomorrow is not possible if we do not bring these discussions on harms of alcohol that we are going to have today. Alcohol affects all three dimensions of the sustainable agenda and almost all of the SDG targets. We cannot end poverty, we cannot achieve gender equality and good health and well-being if we do not address comprehensively alcohol. Alcohol worsens inequalities and harms most of those that are vulnerable. Disadvantaged and especially vulnerable populations have the highest rates of alcohol-related hospitalizations, the highest rates of diseases, the highest rates of death. People in lower income countries, communities, families, they all suffer disproportionately more harm than those that are in higher income settings by consuming the same amount of alcohol. And this is something that, many times I have to explain, because it is many times, difficult for people to understand that 1 liter of alcohol is not, in terms of consequences, the same in high income countries or high income families and lived, in low income families. So we know that in most societies, women and children are the most vulnerable when it comes to poverty, illness, and disparity. And this is one of the reasons why we are here today. Alcohol policies are a question of human rights. They are important to reduce inequalities, and for that we need to include gender perspectives and gender sensitivity into our commitments to address alcohol and in alcohol policies. So today we will hear quite a lot broad variety of issues related to alcohol consumption and COVID-19. And we will be approaching these themes from different perspectives and different experiences of women worldwide. Women are at the center of today's discussion. We'll hear about women's health, and we'll hear about mental health during pandemic, and we will hear about how alcohol consumption has shaped this relationship, how women and girls were targeted by alcohol marketing during the pandemic, and how alcohol got increasingly portrayed as a coping mechanism, especially for stressed mothers. Finally, I would like to express my sincere appreciation to all the people who made this event possible today, especially the great women from PAHO, my colleague Maristela, who has had the idea of organizing this webinar in the first place. So to you, Maristela, to all the colleagues from PAHO, thank you very much for bringing the European region also to these very important discussions. And with this, allow me to hand over back to you, Christina. Thank you very much.
Thank you very much, Karina, and also thank you very much for putting this issue into the bigger context of the history, like what has been actually happening with women empowerment, and what is happening now. Like 1 week ago, exactly as you have mentioned, was the International Women's Day. We could also see a huge corporate capture of the day, and we will talk about it, or we will mention something of it a little bit later. But really, thank you very much. It's an honor being in the same group here with you. And now, as you have also said, let's move to the speakers who will talk and present their research and their experience in these topics that we have on our table today. And as the first one, I would like to introduce Zilla Sanchez, who is an associate professor at the Department of Preventive Medicine at the Federal University of Sao Paulo, and who will talk about alcohol use among women during COVID-19 pandemic and what do we know about that. So Zilla, the floor is yours.
Thank you, Christina. It's a great pleasure to be here with you all, such a great group of women. And I will start this section. Just sharing here my screen here. So, yeah, is that okay? So
yes.
Yeah, I will present some data about alcohol use among women during the COVID pandemic, and we'll discuss what do we know. I will start saying that it's such a jungle of data I have to enter to understand the complete picture of what happened worldwide. So we have produced so many studies, and some of them are contradictory and some are similar. So I will try to explain a little bit about this. I will present 4 facts that we know about this effect of the pandemic on women behavior. And fact 1 is that our timelines in the beginning of the pandemics were populated with several memes of women drinking. For example, here we have parenting during the coronavirus shutdown, day 1, day 3, and here the Barbie, the non-essential work Barbie, the one that stayed at home. And here, just when I think I can't take anymore, I remember that alcohol exists. And here, the homeschooling meme. It may take a village to raise a kid, but it takes a winery to homeschool one. So we started the pandemic with this scenario. But did they represent population alcohol patterns, or were just funny jokes? In a nutshell, it depends. So there is not an exclusive answer. During the pandemics, the patterns of alcohol use did not change equally among several groups. So it changed different among women and men, depending on age group, depending on socioeconomic status, countries, and I will show you difference among countries, depending on previous alcohol use patterns, and I think it's the most important factor that define the change on alcohol use, and also mental health. So fact 2, the patterns did not change equally worldwide, and I will present some data. Starting with European countries, there is a very nice study that performed a meta-analysis with 44 general population studies, only among the European countries. It's the most comprehensive study of alcohol use change during the pandemics, but it's only considering European countries. In general, we saw that the alcohol use declined during the pandemic, but there is some evidence of increase in alcohol among those who already drink. So people that already drink at high levels usually increase their alcohol use. But in general, the general result for the meta-analysis show that we have no chance among women. So for the general population, where we have men and women, alcohol use declined. But when we consider women among European countries, we have a result of no change. But it's important to say that there is a large difference among countries. So for example, in Spain, we have data of a large decrease. But in Denmark, we have data showing that we had an increase, but the final result of the meta-analysis is no change for women. Also, no change for women. But it's important to talk here about the misinterpretation of epidemiological data. For example, when we have a study showing that we had 15% of the population increasing their alcohol use, for example, increasing their daily alcohol doses, it's a part of the population. But we have to look at the whole picture. So we have here, for example, it's an example, 30% of the population decreasing their alcohol consumption. So, and also half of them with no change. So when we look here, what we see that 85% of the population did not increase their alcohol use when we look to the population of a country. However, some of the media some media information and some reports of government had only looked at this part of increase. And they say that the alcohol consumption increased 15% on the population. That's not true. So it's important to look the whole picture of data, not only a part of the pie, to understand what happened. Here we have data on Latin America. I studied, coordinated by Maristela. We have now the report published and two papers published on this data. And it was an online survey in all countries of Latin America and Caribbean. And what did we find? We found that women tend to report less high episode drink and less drinking before 5 p.m. during the pandemic when compared to themselves on the year before. But we had no change on other drinking behaviors. So part of the behaviors faced a no change result, and part of the behaviors, for example, habits of drinking or binge drinking, decreased in the period compared to 2020, comparing 2020 to 2019. But we saw that all the anxiety symptoms were more prevalent among women. And here it's important to show that we did a stratified analysis considering the different regions of the Latin American Caribbean. And again, let me show you here. We have around 14% increase in the southern cone when we find Brazil. We saw a 14% of increase and 20% of decrease. So here we have a part of the group that really increased their alcohol use, and part of the group that decreased or did or have not changed their pattern. So it's a mixed scenario. And in the US, it's very interesting because most of the data published, and we have a lot of data published, especially in the US, and what did the researchers find? Usually they find for the whole population a general increase. It's different from Latin American, it's different for the meta-analysis from European countries. Here in the US, most of the data show a general increase considering drinking days, considering drinking days, frequency, and drinks per days volume. And usually there is no difference between men and women, but there is a special study that shows that we have a 17% increase on days of drinking and 41% increase on days of heavy drinking among US women. So in the US, we have a different picture when we compare with other countries. Our fact 3 is that the crisis has disproportionately affected women's mental health. And mental health is always associated with alcohol use during pandemics. And there is a gender impact for this. So most of the studies show a strong association of alcohol use increase and mental health variables in general. So depression, anxiety, and several others, especially among women. So women were more vulnerable to anxiety, for example, change, and alcohol use as a coping strategy to deal with this anxiety. And we have the fact 4, that is the lockdowns jeopardize women's safety. And also, again, alcohol use was a risk factor and is a risk factor for human safety. And here we have 2 mechanisms. One is that lockdown increases the intimate partner violence and worse mental health among women. And then again, they use alcohol as a coping strategy to try to handle all this process of violence. However, we have also here the influence of the alcohol use by partner. So the more the partner drink, the more intimate partner violence women are exposed to. So it's another information. To conclude, what now? So what now is something we have to discuss more, but some ideas. Mental health screening for women must be better disseminated in primary health care and also in schools, considering girls. Offer a social and governmental support to leave, for the women to leave the intimate partner violence environment. And here it's important to discuss this. And considering alcohol, we have to regulate alcohol. I know that some of my colleagues in this session will discuss this. So we have to reduce the use of alcohol as a coping strategy. And finally, we have to increase the offer of gender responsible alcohol intervention, because we have to consider that the strategy that works for men is not the same that works for women, because usually they are drinking with for different motives. So here is my ideas, and I will pass to Christina. Thank you.
Thank you very much, Zilla. Thank you for actually pointing out that even like women are not a homogeneous group, and then there are different patterns and different behavior, and of course also then different reaction to COVID-19 and alcohol consumption. And also what is very important that you have mentioned is not only the alcohol consumption of women, by women, but also the impact of others' alcohol consumption on women. As you mentioned, then the domestic environment that has become even more dangerous during the pandemic. Thank you very much for sharing your insights. And now we would move to the next speaker, and that is Satlana Popova, senior scientist from Institute for Mental Health Policy Research at the Campbell Family Mental Health Research Institute. Hi, Satlana, the floor is yours.
Hello, just a second, let me share my screen and enlarge. All right. Hello, everyone again. First of all, I would like to thank the organizers of this webinar for the opportunity to present the most recent literature search results on the impact of COVID-19 pandemic on substance use and mental health of pregnant and childbearing age women. The previous speakers clearly demonstrated that women are disproportionately impacted by the pandemic, particularly young women who are responsible for financially supporting and caring for their families during the pandemic. However, little is known about how the pandemic has impacted substance use and other outcomes, such as mental health, healthcare services utilization of pregnant and childbearing age women, as well as neonatal outcomes. Therefore, we conducted a literature search on this topic specifically for this webinar. Here is a summary of the studies found. In total, we identified over 120 studies, and you can see that studies exist in all 6 WHO regions. However, most of the studies in this context have been conducted in the region of Americas and European region. This slide presents a trend in substance use and mental health status during the pandemic among childbearing age women in general population based on 12 studies from Europe and North America. It is easy to see visually that majority of the studies report that substance use such as alcohol, cannabis, illicit drug use is increased. And 5 studies reported increase in either the frequency of drinks, prevalence of risk drinkers, binge drinking episodes, or mean breathalyzer alcohol concentration among the general population of women. Among women in the general population, cannabis use was shown to increase in Canada, but decrease in Germany. Opioid-related deaths increased from 49% to 53% among women in Canada during the pandemic. Hospitalization rates due to substance use increased by 1% in Canada. However, decline of 5% was observed in the rates of hospitalizations due to opioid use. USA studies report increases in the prevalence of women who screen positive for substance use disorder in the emergency department. Okay. Of the 11 studies comparing the change in substance use among men and women in the general population, 9 studies report higher increase in substance use among women compared to men, while 7 studies show that men are more likely to increase substance intake in comparison to women. We found only 3 studies, all based in the United States, reported the trend in substance use during pregnancy, before and during the pandemic. 2 studies showed no change in the prenatal alcohol use or binge drinking prevalence, or in the mean number of substances used during the pandemic. However, as shown in this figure, 1 study, which included over 100,000 pregnant women, reported that the prenatal cannabis use prevalence increased by 25% during the pandemic. Amongst the 9 studies reporting prenatal mental health status pre and during the pandemic, 7 studies demonstrate a poorer mental health status or an increase in mean prenatal depression, anxiety, and stress scores. 1 study from the United Kingdom reported an increase in the prevalence of women suffering from poor sleep, low mood, poor concentration, and loneliness. Alarmingly, the prevalence of prenatal depression was increased from 25 to 51% in the United States and from 6 to 12% in the Netherlands during the pandemic. 6 studies explored the association between substance use and mental health among pregnant and breastfeeding women during the pandemic. 2 out of 3 studies found association between alcohol use during pregnancy and history of mental illness. Other 2 studies found association between prenatal cannabis use and prenatal stress and depression. 2 studies found association between prenatal smoking or tobacco use and generalized anxiety and stress and depression. And one study reported an association between the prenatal stress or depression and increase in the number of substances used during the pandemic. We were also interested in healthcare utilization of pregnant and childbearing age women during the pandemic. And this figure demonstrates the results of a web-based survey of WHO members, ministers of health, conducted by the Department of Mental Health and Substance Use, World Health Organization, between June and August 2020. You can see that many essential mental, neurological, and substance use services were completely disrupted. More than 50% of patients not served as usual, dark green bars, or partially disrupted, light green bars. Specifically, mental health intervention during antenatal and postnatal period was completely disrupted in about 16% of the countries and partially disrupted in 44% of the countries. In total, 6 studies explore the impact of COVID-19 on health services among pregnant and childbearing age women. In general, they showed a decrease in regular mental health, substance use, and antenatal services. For example, as shown in this figure, a study in the United States reported 33% reduction in the regular mental health and substance use services among high-risk pregnant women with opioid use disorder. Another US study reported 25% reduction in the screening, brief intervention, and referral to treatment, even in those admitted to the emergency department during the pandemic. UK study also reported that there was 60% reduction in the face-to-face support among high-risk drinkers during the pandemic. In India, 32% of pregnant women did not attend the required antenatal checkups during the pandemic, and as a result, about 45% had aggravated complications in pregnancy, and the rate of high-risk pregnancies increased by 7%. 4 studies from the WHO European and American regions explored pregnant and postpartum women's views about antenatal and postnatal care during the pandemic. In general, women reported a decrease in support for breastfeeding, childcare, and healthcare in general during the pandemic. This table, adapted from a study conducted in the United States, demonstrates that the first 4 major changes in prenatal services were a transition from in-person to virtual appointments, no prenatal group classes, reduction in the frequency of prenatal visits, and cancellation of hospital tours. A recent systematic review and meta-analysis by Chmielewska and colleagues, published in The Lancet Global Health, explores the impact of COVID-19 on maternal and neonatal health. It was observed that the odds for maternal death increased by 37% during the pandemic, particularly in low and middle income countries. Postnatal depression levels also decreased during the pandemic. In terms of neonatal outcomes, the odds of stillbirth increased by 28%. And briefly, conclusions. Surprisingly, the studies on the impact of COVID-19 on childbearing age and pregnant women exist in all 6 WHO regions. However, majority of the studies are in the Americas and in Europe. And based on the available studies, substance use and mental health problems have increased among childbearing age and pregnant women during the pandemic. Studies also found a positive association between mental health status and substance use among pregnant and breastfeeding women. Prenatal alcohol, cannabis, and tobacco use was associated with stress, depression, and anxiety during the pandemic. And there are some very alarming findings on increasing maternal deaths by 37% and stillbirths by 28% in low and middle income countries. And what is important is that these adverse maternal and neonatal outcomes has occurred simultaneously with the disruption of essential health services that serve to prevent and improve substance use and mental health problems of pregnant and childbearing age women, and thus improve neonatal outcomes. And based on self-reports of pregnant women, there was a decrease in support for breastfeeding, childcare, healthcare services in general during the pandemic. Some selected references are available, and thank you very much for your attention.
Thank you, Lana, very much for this overview. It makes me reflect really what the impact of the pandemic has been. I would say that the pandemic has served as a steroid for the problems that women have already faced before the pandemic. And you really zoomed into that. I have some questions for you that we can then keep for the questions and answers about this, but thank you for sharing with us this overview. And now we would move to maybe the reasons also for the changes in the consumption. And I have mentioned already, for example, the corporate capture of the International Women's Day that we could see last week and also previous years. Of course, it's not a new thing by different industries, including weapon industry and also alcohol industry. And now we will talk a little bit more specifically about alcohol marketing during lockdown. So I would like to welcome Amanda Atkinson, who is a senior researcher at Public Health Institute at Liverpool John Moores University. Amanda, the floor is yours.
Thank you very much. I'll just start my slides. There we go. Yeah, thanks everyone. It's really, I'm really happy to be here today presenting on this really important issue. I'll be presenting some research that we conducted towards the first part of COVID-19 in the UK, looking at how women were being targeted by alcohol brands on social media. So just a little bit of context. We know, like many other countries, like the majority of countries, in early March, late March 2020, the UK population were instructed to stay at home, other than for a number of small reasons, such as 1 hour of daily exercise. This meant that off-site licensed premises were closed. Some repurposed themselves as takeaways, but off-premises, such as supermarkets, off-licenses, etc., were also given status as essential businesses. So given that people were restricted to the home, the alcohol industry faced an unprecedented situation in that the availability and supply of alcohol was restricted, but also importantly, the social context of drinking was very much transformed. So it was restricted to within the home and with individuals within that particular setting. So that meant that obviously the industry had to adapt their marketing to target women with products in new ways. So I'll be presenting a number of themes today that we found in our analysis, and this was the early stage of a much broader project that we've been working on over the last couple of years, which has been looking at the way in which marketing is gendered and how that is created, influence, and how it's influencing on women's drinking and also the drinking practices of LGBTQ+ people, but also how it's regulated and the effectiveness of that. So this data is from the first stage. We've done an analysis of posts by alcohol brands, 20 brands on social media over an 18-month period. And that included the first and second UK COVID lockdown. So we were able to look at how marketing shifted to target women during that time. We also done a thematic analysis on comments left on COVID-19 corporate responsibility initiatives that brands were posting about during the first lockdown. And as of this week, we've spoke to 150 women about their views and experiences of alcohol brand and also nightlife venue marketing. So I won't say too much about that in the presentation, but I'm happy to talk about that in the discussion as we've just started analysis, but there's still some early themes. So first of all, I want to say a little about how brands continue to target women. So as well as adapting their marketing to address the changes under COVID-19, they continue to use established feminized marketing during that time. And the first theme, which I'm sure you're all aware of, is the general pinking of products. And this is a very popular strategy that's used by female targeted brands. Most brands have a pink product, a pink gin. I think it's fair to say that gin has had an image makeover in recent years. If we compare, the depictions of the kind of gin crisis, etc., in the UK, compared to this kind of proliferation of gin and the popularity of it in recent years. So this was a very common finding. And, we can perceive this as a negative gender stereotype, pink, the associations of femininity that go alongside with that. Some women were very critical of this. Others view this type of marketing as a celebration of womanhood, and also some young people that we spoke to perceive this kind of pinking of products generally as taking on feminist connotations as well. The example in the bottom right there is an interesting one, as this theme overlaps with what we call time-related marketing. So when brands try to encourage women to drink on certain days and at certain times, so you can see there it's trying to promote drinking of pink products on Wednesdays. A big theme was female friendship and bonding, and this is one of the most prominent themes used to target women, and it very much contrasts with the targeting of men. Very few references to friendship and bonding, other than kind of football friendship associations with male targeted products, but predominantly women are targeted through this notion that alcohol is an essential component to friendship. Whatever that friendship activity might be, that alcohol can bond the friendship group. That also overlaps with what we call engagement in interactive marketing. So brands draw on this idea of friendship to get consumers to engage in their posts online. So asking and encouraging women to tag their friends in posts, to share with their online friends, and to tag their friends in posts as part of competitions to win a whole range of activities and prizes. And a very much an appearance-based and consumption-based femininity is promoted. So a focus on shopping, clothes, heels, and makeup. And again, we can assume that's interpreted as a negative gender stereotype, which for some young women that we spoke to, it was. But many women expressed, enjoying this type of gender performance and the activities that are involved in kind of beautification of themselves. And therefore, they did relate to this type of marketing. Interestingly, we found that some brands have started to use body positivity discourses and also kind of diversity in what we may define as beauty. And we can see that as kind of using contemporary feminist messaging around body positivity. So we can see how this traditional femininity alongside body positivity works in a way to broaden the appeal as it targets women that might take on this traditional form of beautification, and it might also appeal to women that define as feminists through body positivity. Associated with that was, a long-standing use of calories to promote products to women, but linked to that notion of body positivity, some brands were rejecting this notion of calories and rejecting diet culture, telling women to kind of embrace their imperfections, again, using more kind of fourth wave contemporary feminist messaging. Brands promote alcohol as a way for women to manage their, increasingly stressful and busy lives, whether it be as mothers, as workers, as friends, as partners. Alcohol is presented as a reward. It's presented as something that you can indulge in to give yourself me time. We're all familiar with the concept of wine o'clock. Self-care narratives are also prominent, so including alcohol in posts around, taking time out to pamper yourself. And some brands are increasingly designing small products, which they promote as something that can be easily slipped within handbags and something that women can drink on the go within their busy working lives. Linked to that is this notion of motherhood, which is obviously very relevant to the discussions we've had so far today already. And motherhood is celebrated and alcohol use is encouraged in celebrating motherhood. So, for example, encouraging women to drink with their daughters on Mother's Day. But alcohol is also represented as a way for women to escape the traditional gender role of motherhood, to reclaim their identities as individuals. And alcohol use is associated with the stresses of motherhood. So it's something to participate in when the kids have gone to bed after a very stressful day. And obviously, you know, as we've discussed today, the stresses that were heightened within during the COVID-19 pandemic may mean that some of these messages were more prominent to women, you know, women homeschooling, for example, you know, very important considerations. Another theme is relationships and singlehood, so very much kind of heteronormative notions around Valentine's Day, but increasingly brands are kind of reflecting broader concepts of relationships. They're very much, I'm sure you're all very aware of how they promote LGBTQ plus issues, and also increasingly we found this message of women should celebrate singlehood as a notion, an example of being empowered, that you don't need men. Have a drink, you know, celebrate your singlehood as an empowered woman. Linked to that, you know, as we've kind of drew on already, you know, Christine has mentioned International Women's Day, sponsored by Diageo. Lots of brands increasingly are drawing on gender equality messages and social causes generally, whether it be Pride, whether it be COVID-19, as I'll go on to discuss, social cause marketing around that. So a number of examples here, including brands you know, drawing attention to sexual consent. A lot of interesting views from women on that, which I'm happy to discuss in the discussion, and even brands collaborating with feminist campaign groups here in the UK. So that's how brands continue to market their products using long-established kind of gendered and feminized marketing. And I just want to spend the second half of the presentation talking about how they adapted their marketing within the context of the pandemic. So first of all, they addressed changes in availability and supply. They intensified the promotion of online sales, and online purchasing was presented as a way to shop safely, so because it prevented you from having to enter supermarkets. Some brands were encouraging stockpiling, as we can see there in the top right, and some brands brought forward new and limited edition products, and they presented this as almost you know, almost doing consumers a favour by bringing product promotions forward and giving them something new to enjoy during this lockdown period. Secondly, they had to adapt to this changing social context of drinking, and they encouraged and intensified the promotion of home drinking in a number of ways. So they presented alcohol as something that could alleviate lockdown boredom, and they suggested a whole range of entertainment activities that people could engage with alongside their alcohol use. So, you know, Netflix and chill, bingo, and baking with products, even art-based activities, for example. They also shifted their competitions, so rather than kind of providing tickets to social events, etc., they collaborated with organisations such as Deliveroo, providing free takeaways if women tagged themselves and shared posts with their friends, and these takeaways were presented as being enjoyed alongside alcohol. And generally, they suggested that people should embrace the mundane. So the example here of, you know, how everyone was living in their sweatpants and their tracksuits and pajamas, etc., and how this should be embraced alongside alcohol within that unique context. Home recipe suggestions for cocktails and food pairing was intensified. So the example there, feeling stir crazy, he's a cocktail recipe. In the UK, there was this, I'm not sure if it was the same in other countries, there was this online kind of fad of baking banana bread. And you can see that, you know, they're even referencing those kind of, those viral fads there. Boards making banana bread, try your hand at a cocktail instead. And the home was also redefined as a party context, so staying in was represented as the new going out. The kitchen was kind of redefined as a dance floor, and some brands even provided activities such as lessons to improve your dancing skills, so you could, you know, have a party at the weekend in the kitchen. Self-care at home, a really interesting finding, associating alcohol use with a way to deal with the stresses of COVID-19, to take some time for yourself, not to forget yourself, and celebrate the small wins and the small things. So celebrate the fact that you've got through the day within this stressful context by treating yourself to alcohol. And virtual drinking, as you might imagine, was encouraged. So people were encouraged to stay connected, to do a kind of theme of togetherness, to interact with people and stay in contact with friends outside of the home by virtual calls, where you could have a virtual cheers with your friends. And to reinforce that, brands actually hosted their own virtual events, everything from online bars, cocktail making sessions, music events were streamed, brewery tours, even flower arranging sessions for women as part of competitions to encourage people to interact online and to consume alcohol. And the last main theme was how brands actually referenced the COVID pandemic itself. So they promoted transmission suppression activities, encouraging people to stay at home, have a drink, stay at home and help save lives. And again, there was this notion of togetherness and how we need to work together as a community to address the pandemic. And, you know, that could also include staying at home and having a drink. There was also, you know, linked to this notion of increased use of social cause marketing by alcohol brands and many other brands. And generally, this wasn't just female targeted brands, but this was across the board. There was lots of brands that were providing PPE, producing hand sanitizer, providing donations to COVID charities and COVID related issues. And some brands here in the UK even made political statements. So during the first lockdown, initially the UK government weren't providing free school meals for children in need who were being homeschooled. And Brewdog, which is a big craft beer brand here, took it on themselves to deliver free school meals within their local area. And we could obviously make the link between schooling. You know, women tend to be the ones, you know, that drop their kids off at school, that have that involvement in homeschooling. So we could potentially see that there's a you know, a targeting of mothers there through this free school meal campaign. And through our analysis of online comments on this type of marketing, we found that overwhelmingly it was perceived very positively by people online. We obviously know that people that post online don't represent the general population of consumers, but generally this type of post was being perceived as brands doing their bit to help the community and address the spread of COVID-19. So that, to very, very quickly summarise, we can see how brands continue to use feminized marketing that reproduces gender stereotypes, but also increasingly draws on empowerment and gender equality messages, including the endorsement of International Women's Day. The UK lockdown meant that they had to pivot their marketing to encourage home drinking, and they did that in a number of ways, including through encouraging drinking virtually, online. And they also referenced the health and social concerns associated with COVID-19 in an attempt to kind of present themselves as doing good in times of crisis. And as I've just said, that seemed to be perceived by people in a positive way. In terms of the drinking levels, in changes in drinking levels during in the UK during this time period, people were affected in different ways. There's evidence that some groups increased their drinking and some people stayed the same and some people reduced. In terms of the influence of this marketing, obviously this was a content and thematic analysis, so it wasn't you know, and it was qualitative work, it wasn't a cause and effect study, but there's a strong evidence base now to suggest, and you know, we know that marketing does have influence. So I think it's fair to say that these messages will have influenced you know, women's experiences of drinking during this time period. And just to add there that within our sample of 150 women that we spoke to, around 30 of those were currently sober, a lot of them very recently sober, making the decision after increasing their drinking during COVID, making the decision to abstain after that period due to mental health issues. And they were, you know, as you can imagine, a lot of them were very angry, particularly around the associations between motherhood and alcohol use. It was something that they related to, and there was lots of critique of that as a marketing strategy by that subgroup of women that we spoke to. Thank you.
Thank you, Amanda. I think that this is just amazing how the industry can really exploit everything and play on both sides and be very ambiguous, exploiting the traditional roles, exploiting what is emerging, and the topics or the socially progressive issues that are but we have to make a really note of it that they are already endorsed by critical mass. The industry will not go into some new area that is really not explored yet, but they can really explore as soon as they identify. And thank you also for talking in the last part of your presentation about the concrete women, because that is a very good bridge to the next presentation that we are having. And I will need the help of a colleague that will play the video of Katerina Georgi, who is the CEO of Foundation for Alcohol Research and Education, FAIR Australia. She is not here with us because it's 2 a.m. in the morning. 2 a.m. is morning in Australia, so it will not, she couldn't, but she has recorded a video where she really brings the concrete women and how they experience the pandemic and the influence of the industry practices on their lives. So if I can ask someone to play it, thank you.
Hi, my name is Katerina and I'm the CEO of the Foundation for Alcohol Research and Education in Australia. I want to thank you for inviting me to be part of this event. And I want to start by acknowledging the traditional owners of the land that I'm meeting on, and to pay my respect to the Ngunnawal and Ngambri people and their elders past and present. I'm going to share my screen with you today because I have some slides prepared. So I'm going to be talking to you today about alcohol, women and COVID-19, and share some experiences from Australia. Because we've just come off the back of International Women's Day, I do want to acknowledge some incredible women and the work that they have done in advocating for alcohol harm reduction in Australia. So firstly, I want to introduce you to Ange. Ange says that prevention is key. However, I would be remiss not to address any woman who may already have consumed alcohol during pregnancy and are worried about their child. The correct diagnosis is always the best diagnosis, and women need not feel shame or blame in disclosing alcohol use during their pregnancy in order to get help for their children. It's incredible to have advocates like Ange who are sharing their lived experience to try and prevent FASD, but also make sure that people impacted by FASD have the right supports available. This is Auntie Helen. Auntie Helen is from the Aboriginal community of Bagot, and she advocated to stop one of the country's biggest bottle shops from being built near her dry community. She was successful in that, with the big alcohol retailer backing down last year. And she said, it just goes to show people that if you can use your mouth like I do and use it in the right way, you can get to where you want to go. And finally, here's Shanna Wan. Shanna uses her experience of alcohol addiction to start a charity called Sober in the Country, and she advocates for alcohol harm reduction. And she said, I do it because someone had to go first, and I do it because every single one of you knows my story is not unique. I think it's just incredible to have so many amazingly strong women advocates, and not just the women who are advocating for change now, but those who have done so for many, many decades. We're absolutely standing on the shoulders of giants in the work that we do here, and the advocacy that these women do absolutely does create change. In talking to you about alcohol and COVID-19, I really wanted to share some quotes where we can hear directly from women and their experiences. We asked through our Your Voice project how people felt about alcohol and alcohol use during COVID, and here are just some of the things that we were told. During COVID lockdown, I struggled to cope, being unable to leave home except for essentials. However, I was surprised that bottle shops were open, hence the start of my decline. Not normally a big drinker, I began to have a drink every day. I started earlier each day and I was alone. By November, I would say I was addicted. And another, I really battled with it all because I saw that my health and well-being overall declined during the pandemic. Less movement, less fun, less social support. And I knew drinking wasn't going to help that. But I also felt like my partner needed me to drink with him. And it was a way to mark the end of the day or mark a weekend. Another story, as a mum to a young baby, I was overwhelmed by the bombardment of alcohol advertising, memes, and drinking content on social media during this time. I watched with sadness as friends in mothers groups started drinking every night, and the incessant posts through parenting groups was disheartening. It's no wonder consumption in some groups increased through the normalization of these activities. And just one final story to share. I have always been someone who would drink on a daily basis. Being in an office environment controlled the window of opportunity to a great extent. During work from home, my alcohol intake skyrocketed. At first due to anxiety and loneliness, and then mainly due to the opportunity and lack of accountability. I drank stronger drinks starting earlier, usually from around 2 p.m, but sometimes earlier to cope with stressful meetings. I think that the workplace provides an enforced alcohol-free environment, which is a safe place for people with addiction problems. I went back to work full-time in the office at the first possible opportunity. I think what these stories show are some things that we've seen reflected in the data. It shows that women were particularly susceptible to increased alcohol use. They experienced great levels of anxiety, which led to more drinking. The change in their routine from day to day meant that they might be drinking earlier in the day. And also the increased burden of things like homeschooling or additional childcare also contributed to increased alcohol use. So when we look now at the data, here's an example from the Australian Bureau of Statistics, and this is from early on in the pandemic. It shows that women were twice as likely to increase their alcohol use over the last 4 weeks when compared to men. A survey from the Australian National University showed that 1 in 5 women increased their alcohol use, and they were more likely to be aged between 35 and 44 years. It also showed that women who had child caring responsibilities were also more likely to increase their alcohol use. And here's a further survey on women's health, which showed that 1 in 5 women reported increased alcohol use since COVID-19. And again, it was showing that the highest rate was for women aged between 25 and 44. So when we actually try to understand the social practices involved in alcohol use among women aged 40 to 65 years, here are some of the things that we know. So we know that alcohol is seen as a demarcation between the duties or the responsibilities that you have and that winding down. It's almost earned. This is from the Centre for Alcohol Policy Research and some qualitative work that they did. They found that in the weekend, it was tied to social connection and wine was seen as a hobby. And they also found lots of social pressure to drink alcohol. And there were times of the year when you didn't have to drink alcohol, but they were periods like dry July. Otherwise, it was almost implied that you would drink alcohol in different circumstances. So knowing this, knowing that we've seen some increasing rates of risky drinking among women and the reasons why, what can we do to try and help? What can we try to do to make sure that there are supports available and that we're doing all we can to prevent the harms from alcohol? I'm going to talk about 4 different things now. So firstly is increased information and education. We need to make sure that there are supports and information and education that's targeted at women. One of the campaigns that we've launched here at the Foundation for Alcohol Research and Education in partnership with the Department of Health is called Every Moment Matters. And it raises awareness of the risks of drinking alcohol while pregnant, planning a pregnancy or breastfeeding. The message it provides is that the moment that you start trying is the moment to stop drinking. And I encourage you to look at this campaign at everymomentmatters.org.au. A further campaign was called Ripple. This was a pilot that we worked on with the Centre for Alcohol Policy Research. And what it was a website, an app, and the app was interactive and it sent text message prompts where it gained information about people's alcohol use and also tried to provide feedback and information on how to reduce alcohol use, how to deal with different circumstances where it might be difficult to cut back. This app was particularly targeted at women aged 40 to 65, and the reason is because we've seen a trend of increased risky drinking among this population group. You can find out more about Ripple at fair.org.au/Ripple. We also need greater alcohol marketing controls, and I know there's another presentation being dedicated to this today. Just here, I've got a few examples of some ads on social media that use International Women's Day to push alcohol. And so what we see and what we've seen during the COVID pandemic is that there's been lots of COVID-themed alcohol marketing. We've seen a real explosion of it, particularly online. And what we know is that there aren't great controls around alcohol marketing. In Australia, as in many countries, you know, marketing is regulated by voluntary codes. And I don't even think I'd say regulated. These are rules that alcohol companies set for themselves. And they monitor themselves, and they're completely flawed. And so we need greater controls on alcohol advertising because it's just far too prolific. And the data collection capacity that's now happening through alcohol marketing, because it's increasingly happening online, is really concerning, because it by design means that people who are most vulnerable are being targeted more by alcohol marketing. Online alcohol delivery controls are needed because online alcohol delivery has exploded during the COVID-19 pandemic. Here I've got a quote from Kim Valentine, who is a member of the Victoria's Victim Survivors Advisory Council. She shares this on her experience. The crackle and squeak of car tyres pulling up, lights piercing through the front window, the sound of footsteps coming towards the door. However innocent this description of home alcohol delivery may sound, it sends shivers down the spines of victims of domestic violence living with an alcoholic. We really need to make sure that we have controls in place around online alcohol delivery. And some of the things we're advocating for are restricted hours of delivery, that rapid delivery is restricted as well, because we know that rapid delivery is associated with particularly risky drinking. And in Australia, there are some places where you can order alcohol to your door within 20 minutes. And that online age verification happens so that we're checking ID and we're making sure that alcohol isn't sold to people who are intoxicated. Finally, we need to maintain the strong public health measures. So alcohol companies and their lobby groups are using the COVID-19 pandemic to try and advocate for cuts to really successful and strong public health measures. And at the moment, they're trying to cut the alcohol tax or beer tax specifically. And so it's really important that these measures are maintained, and also that their false narratives around COVID-19 are challenged, because we are seeing at the moment some increased risky drinking and increased harm, and we don't want that to get worse. So I want to thank you for hearing from me today about COVID-19, alcohol use and women in Australia. And I also want to flag that, you know, we know that there's increased risky drinking. We know that there's increased harm. We know that women also are more likely to experience family violence and violence involving alcohol in the home. And so we need to be doing all we can to try and prevent this harm. And we need to be doing all we can to make sure that there's strong regulation in place so that alcohol companies aren't taking advantage of people during COVID-19. So thank you again for inviting me to be part of this. And I'm sorry that I couldn't be there live due to some time zone constraints. But I look forward to hearing more about the discussions that have gone on today.
So thank you, Katerina and Fer, for bringing or putting the human face on the issue that we have been discussing the whole webinar today. And before we go to the questions and answers, I would like to invite Dr. Maria Elena Medina Mora, who is the director at the Department of Psychology, National Autonomous University of Mexico, to shortly comment on what we have heard today.
Thank you very much for the invitation. I need to say that the women's situation is very equal in the world. So the issues that have been presented by, you don't hear me?
We hear you.
Difícil escucharla, muy bajo.
Okay, let me. I was saying that there are many commonalities of what has been shown in the different presentations, and I like very much what was included. So I am going to be just commenting on some special issues. One is related to the fact that all the social determinants that have been making females drink more are there, and that we have to take care of them. So we have more poverty, we have more violence, we have more females staying at home. And in Mexico, we have found that during the confination, the females had to stay at home. Alcohol increased. I will give you some data later on. So when we think on policies, female-oriented policies, we have to think about these social determinants to really make a difference in the woman's life. Because very soon in the pandemic, or it was recognized the excess of the burden on women that had to work at home, take care of the children, the house, and then become teachers. In Mexico, all schools were closed for 2 years, and females became the teachers of their children. So and there were no policies to help them if they have to work, to have more flexibility in the work. So I think we need to have these situations arranged. Also, the other issue was that in the first period of the epidemic in Mexico, there were dry laws, and there were 21 states that delivered some type of dry laws, and another communities that included other policies such as time and hours to be sold, and an amount of places to be sold. And during the first part of the pandemic, we did see a decrease in alcohol use, but with 12% of increase. Brazil reported 15%. We had 12% of decrease in the national survey. But this population that had an increase are special populations that really need to be considered separately. But in the second part of the pandemic, when the dry laws were removed, and when the alcohol was home delivered very easily, with no restrictions of how many times during the day or night, or if they could be delivered to underage populations. So these special situations, boredom, 2 years of some type of confinement really made life difficult for many people. So then we think there is an increase. We don't have still national household surveys, but I will talk about a little bit about what our surveys say. And for instance, among students, in a study of 5,250 students, before the pandemic, 82% of females drank alcohol. In the second wave of the pandemic, 78% drank alcohol. When we see through the ASSIST questionnaire, 10% of females would have required treatment before the pandemic. And after the pandemic, 13% of females required. So we had an increase of females requiring treatment. 11% of the women from 20 to 40 years of age had this need, and 16% among those older than 25 years per age. Other finding is that during confinement, the partial lockdown, more females than males reported increase in alcohol. So this was something that we need to study, as this is a hypothesis. It is very consistent with what has been reported, and I think we have to do more research related to that. The other issue is special populations, and one very special population was the health population. So there was a survey with almost 6,000 health workers during the first part of the pandemic. I would say that Mexico probably is the country in the world with more deaths in the health workers. So it was really stressful for them. And the alcohol abuse or harmful use of alcohol was important for males and females. And we find that 10% of females and 19% of males reported this type of use during the pandemic. And the difference between males and females is lower than what was observed before the pandemic. So there is another part of information that we need. In Mexico, most of the health workers that took care of COVID patients were females, nurses especially, because it is estimated that around 70% of those that took care of patients were females. And this is related to this tendency of females to choose care-related works that are unevenly paid in comparison with men, and also because when the transformation of the hospitals was made to only deal with COVID, the persons that were in charge of other patients that then could also have COVID but were not put in the hospital for COVID were females, and also they were the persons that were in charge of taking care of the families, because the doctors and the females and males that were in the first line contact could not do that. So the families were very preoccupied having their relatives come walking to the hospital and in 2 hours be dead, and nobody could explain, and they would give back to the family only not the body of their family member, but only I don't know the word in English, I'm sorry, but that they were cremated. And that was very difficult for families. And there were also females doing that. And also, as many parts of the world, services were closed. So services were then not available.
Thank you, Maria Elena. I think that this is very interesting, the dimension that you are adding into the whole problem. Like we've been talking about women and COVID, and again, like the representation of women in the healthcare system and the impact of it also on that system. And I'm just watching the time, and I actually regret, the only thing I regret is that I in the beginning announced that we will have lots of time for the discussion, because now we are really running out of the time. But I have checked the questions that we have in the questions and answers, and I would ask 2 questions at the same time, and then I would ask the speakers to choose one of them and address them, because one question is related to the presentation of different data now that we have heard. I think it's Ilana who asked, like, there is lots of information, but it's still a little bit somewhat confusing. So could someone here summarize the main findings? Could you tell us how the situation then is? So that would be one round of the questions. And then the other one that I have now noticed is the alcohol industry and how come that when knowing about all the harm that the alcohol products are causing to women in this case, how come that there is no bigger outrage? What is your take on that? How do you see that? And yeah, so let's I will just throw these 2 questions to you, and you can choose the speakers to which one to answer, and that would be also the last the last word that you would have during this seminar, and then I will pass the floor to Maristela to close the seminar. So do we have any volunteer to start? Zilla.
Yeah, I will start with the epidemiological data. So we have different sources of data. For example, there are different study designs. Some studies that are retrospective, other are cohort studies. So we have different study designs and also variables. So some studies collect data on doses and some on habits, on prevalence of episodic drinking. However, the study from Jürgen Hahn group that did this meta-analysis of European data has considered all these issues. And they found, in Europe at least, no change to small reduce in alcohol use. However, for the other countries, we don't have this meta-analysis, this synthesis of data. So I cannot answer for sure, but in Europe, we have a little bit more data and confidence on results.
Thank you, Zilla, very much. Do I see anyone else who would like to address this question out of panelists? No, I don't see that. So, yes, Lana, go ahead.
I just wanted to clarify, my data was mostly focusing on pregnant women, childbearing age women, and breastfeeding women. So it's a little bit different from the previous speakers. To make it short, maternal outcomes and neonatal outcomes worsened due to COVID-19 pandemic. Substance use seems, based on majority of the studies, increased. Mental health problems also increased. And we saw some very sad outcomes in terms of maternal deaths and stillbirths among, especially in low in middle income countries. So due to this reason, unfortunately, we could expect increase of fetal alcohol spectrum disorder prevalence and other adverse neonatal outcomes, unfortunately. Thank you.
Yeah, thank you very much. And then if you could follow, I would actually want to know how the relation also with Zilla, the policies that were then introduced during the pandemic, how they influenced this, like what was happening. So I hope someone is putting it together and will present it at one point for all of us. And now we have the second question, and it's like, why isn't there outrage? In chat, I'm reading that some people are outraged, and that's very positive. So, but how do you see it? What's happening? Why is the outrage only so small?
Yeah, I'm happy to go with that. I think you know, firstly, you know, alcohol is so ingrained. Just thinking from, you know, a UK context, it's such an ingrained part of our culture and our tradition. And there's a general, I think, lack of awareness amongst some people of the harms, etc. And I think particularly in relation to women's use, the associations with the fact that with empowerment, so it's perceived as, well, women can now participate in something and in a public drinking space where once they weren't allowed to or able to. So I think sometimes messages around reducing women's drinking and trying to promote reductions in drinking can be perceived as potentially going backwards and taking something off women that they see that they've earned with, you know, from the, you know, 70s, second wave feminism onwards, if that makes sense. So I think sometimes it's perceived as taking away something that women can do. And I think secondly, I just want to say that there is outrage by some sections, thinking intersectionally. The interviews that we've done, as I mentioned earlier, with women who are currently sober or sober curious, there's a lot of outrage there around, particularly around associations with stress, mental health, motherhood. And also our interviews with women generally, whether they drink a lot, whether they drink little, whether they're sober, we were actually surprised at how critical women were of social cause marketing, including some of the gender equality messages. A lot of people were very much aware that there was a contradiction between alcohol as a product that harms women, whether that's through their own consumption, whether that's through associations with domestic violence, sexual violence when used by men. There was a lot of awareness of the contradiction between a brand promoting gender equality and a product that actually can cause harm. So there was a lot of critical thinking amongst women. And a lot of the cause-related marketing generally, people were quite cynical of. Other than the COVID-19, people saw that as a genuine help within that context. But whether it was pride-related marketing, gender equality messages, even some of the more environmental and the greenwashing, people were kind of quite cynical of brands kind of jumping on social justice issues. So yeah, I think that issue of women feeling maybe something's being taken away from them, and secondly, that there definitely is outrage. It's just maybe not as widespread as what we'd like it to be.
Thank you very much, Amanda, for this perspective. And I take it also as a homework for civil society to make even better, to do even better work, to bring together all those who are at outrage, to make the voice louder. And also, as also some people in the chat are even writing, like the way how we talk about the issues are really important. It's really important, as alcohol is so normalized in the society that it's like balancing on the rope if you want to talk about these issues. So we need to find, and we are developing these ways to discuss these issues in a way that no one gets offended, but people get actually motivated to act upon the facts and the reality. Thank you so much, everyone. I would like to thank from my side, before I give the floor to Maristela, that I could moderate this conversation. It was really an honor to listen to you and to hear your perspectives, and also to read questions and comments from the people in the chat. There is lots of engagement, so it's very exciting. Thank you. I feel very energized, and now I would love to give the floor to Maristela, who is actually behind the idea of having this seminar, which I also thank you for, which will be the last contribution, and then we will close the meeting.
Muchas gracias. Y antes de todo, quiero agradecer muchísimo a la participación de todos ustedes. Y esto sí fue una gran celebración del día, pero que sobre todo es un periodo, en verdad, todo el mes de activismo, como se habló antes, que me lleva desde todo que se ha discutido a identificar dos puntos fundamentales. Las inequidades que ya existían y que ya conocemos, que las mujeres no tienen los mismos derechos, condiciones, oportunidades que los hombres, se peoró mucho con la pandemia, por supuesto. Mismo si el alcohol no ha incrementado tremendamente entre las mujeres, las vulnerabilidades, los riesgos que llevan a una persona, a una mujer y a hombres a incrementar su consumo, todos incrementaron durante la pandemia. Y además del consumo en la mujer, hay el consumo entre los hombres, que por su vez, combinado con la violencia, los perpetradores de la violencia, cuando consumen alcohol, su violencia es aún más grave. Y sabemos que hubo incremento del consumo excesivo entre hombres también. Si bien no sabemos de la consecuencia, por muchos motivos éticos, incluso no se pudo preguntar durante la pandemia, sabemos sí que podemos decir que el riesgo ha incrementado a las mujeres. Y incluso quiero volver a lo que Lana habló de los problemas que durante el periodo prenatal, con consultas, apoyo a las mujeres. Esto indica que la pandemia no terminó y las consecuencias de la pandemia se van a continuar por años. La falta o la disminución de la posibilidad de recibir estos aportes en el periodo prenatal, educación para cómo lidiar con sus niños, y sabemos que hay consecuencias normalmente al desarrollo sano de un bebé, un niño. Y la depresión afecta a esto. Entonces, además del alcohol, tenemos que dar seguimiento a las consecuencias a largo plazo. Incluso puede ser que haya aumentado la prevalencia del síndrome alcohólico fetal, que solo en algunos años vamos a tener una idea de esto. Y de un lado, con todos los riesgos, vulnerabilidades que se mostraron acá, tenemos una industria que quiso aprovecharse de las mismas vulnerabilidades para vender aún más bebidas alcohólicas, promover más el consumo, no llevando en consideración la situación que las mujeres, nosotros tuvimos durante todo este periodo. Obviamente también promovieron consumo para los hombres, pero utilizar los símbolos, las imágenes sexistas, estereotípicas, como se habló, para vender durante un periodo que sabemos que fue tan sencillo y continúa siendo sencillo, es realmente para causar outrage, como uno ha hablado. Entonces, sí, hay que promover este activismo, debe continuar. Y es por esto que hacemos estos webinars, y quiero agradecer también todo el apoyo de la región de Europa que hicimos conjuntamente. Faltó el logotipo de la oficina de Europa, pero sí, cuando enviamos todo va a estar con todo, porque sin ellos no habríamos llegado a esto. Y agradecerles a todas por una tremenda participación. Son todas mujeres que, por cierto, todas nosotras sufrimos, pero también continuamos a trabajar y a contribuir a la ciencia y a la abogacía y a las políticas de alcohol. Muchas gracias. Okay, goodbye. We'll end the webinar now.